Hey, I've been getting several patients asking me about filling the frown lines. People who move their eyebrows end up with a central line. They might also get two lateral lines, the famous 11 line or frown line, where they get two lines. People who make that frown movement end up with a central line. They might get two lateral lines, which is the famous 11 line or frown line, where they end up with two lines. You might see the hatchet mark, a single line in the middle here, or the hatchet mark, which is a single line in the middle. And there are people who have told me that in other places they have had it filled. This part, whether with fat, plasma, hyaluronic acid, and sadly even with biopolymer. So let me tell you that there is a health alert, and not just in Mexico, but worldwide, that in this part of the face, no fillers of any kind should be applied. Okay? There are certain veins and arteries that run through there and connect with the veins and arteries of the eye. So he shouldn't be filling that area, because while complications are very rare, when they do happen, we practically run the risk of leaving the patient blind. I mean, literally, the patient ends up blind. So the side effect is very serious. So this means we don't do this treatment. And I repeat, in many countries, in many parts of the world, it's prohibited to fill this area with no type of hyaluronic acid. There's a hyaluronic acid on the market that uses the famous blanching technique, which, let's be honest, is a mesotherapy technique. It's a technique that doesn't work for filling in the grooves. So I reiterate, for the issue of filling in the groove, here the groove between the eyebrows, it shouldn't be filled. Botulinum toxin is applied there, and when the contraction comes back, it's applied again. And after 3 or 4 applications of botulinum toxin, believe me, you're going to see a very, very noticeable improvement. And obviously, there are other treatments that can be applied there, like threads, smooth of course, apply a night cream to restructure or regenerate the skin. Platelet-rich plasma, I mean, many treatments can be done, but please don't let them fill this area of the face. And go to professional doctors. Thank you very much.